Buenos dias, good morning. Welcome to Tiempo. I'm Joe Torres. We have to begin with the topic of health care. This morning, we're taking a look at an effort to help Latino families who have children with special needs. They can often face barriers in assessing critical medical services and finding the right health care providers. Well, now the Young Adult Institute Network and Premier Healthcare are hosting a Spanish language health care conference. And joining us now with more are Dr. Arlene Garcia from Premier Healthcare and Maria Alo Reyes, whose son was born with cerebral palsy and has overcome the odds in many ways. And we'll learn a lot about Randy when we get into this. So this is the 7th year now, Doctor, you're doing this, right?
That's correct.
Growing
yes.
bigger and better each and every year?
We have. Last year we had about 400 people attending the conference, and this year we expect the same.
What have you learned in the last 6 years as you've done this? What has surprised you each time you go out and do it?
There's a big need for people who basically, to get information in Spanish. They have enormous amount of information that they just don't have because there's no way of receiving the information correctly. So this is what our conference does every year. We bring topics in the healthcare issues, but we also have topics in terms of benefits, understanding psychological types of testing, autism. It's a very varied...
What's a typical story from a mommy or daddy who shows up at the conference and speaks to you and shares some of the challenges that they have faced in years past?
Well, first of all, they're grateful because this is a unique conference. We don't have really, to my knowledge, any other conference that speaks directly to this population, to patients with disabilities, intellectual disabilities, and to their families. So they're very grateful that we have this, and oftentimes they'll tell you that there's things they just didn't know, specifics about benefits they had. They did not know how to approach the systems to obtain it. Yeah, the access is difficult because it's already a cumbersome system, and then and in addition, there's a barrier with the language, with the culture. So they're very grateful.
Maria, have you been to the conference before?
Oh, definitely. Yep. And I think this is the best way for all the Latino community, with special needs members, because that's the way that you can share stories, that you can feel confident, that you can start feeling like this is not the end of the world, and you have help.
Tell me about Randy.
Oh, well, Randy now is 18 years old, and we started with YAI when he was before 2 years old.
Wow.
And we have a long way. We found a lot of support from YAI since the beginning. Randy started with the early intervention program. Then we moved to the system, the public system, where we have a lot of challenges, but I always have people from YAI that, guide me. They help me to go through the system.
Pero Randy, ¿habla español o inglés?
Oh,
¿O los dos?
Español.
¿Español solamente?
Aprendió
just Spanish.
Automático. But we focus on English at the beginning because he did not supposed to talk. According to, the doctor's expectations, he was not supposed to walk or talk because of the damage, the severe damage that he had. So now Randy's walking. He just braces, hand splints, has 20 surgeries, many,
So has this, let me ask you personally, has the conference and the information that is relayed at the conference been more helpful to you or more helpful to your son? Or both, I guess.
Well, I would say to me, because I'm the case manager.
Yes, of course.
I'm being his, the parent advocate, not only for my child, but for other families in YAI, because like the doctor says, there are a lot of barriers in the Latino community. Sometimes they can share their stories or ask for help to another parent instead of a professional.
And doctor, that raises a good point, because this is often a two-way street, right? In order for you and doctors to come up with the diagnosis, you have to understand what the symptoms are, and you can see that from an outset, but you need input, correct? Do you not, from the patient?
Absolutely. And this is what we try to do. Some of the topics are about diabetes, for example, which is epidemic, not just in the Latino community, but in the community in general, the general population. So we try to teach, basic language so that people, when they come to their own doctors, they can ask the right questions. They can feel comfortable.
Por ejemplo, what would be a common term or word that they need to master
For example, someone comes in with problems with their skin, with ulcers, they're weeping, they don't know why they have it, they're an obese patient, and they have other symptoms, úlceras. But they don't know also, they don't know that in addition to that, they probably have diabetes. This is why their ulcer is not getting better. So we try to tell them what are the other symptoms they might have besides, the typical symptoms of dizziness and blurred vision and all that stuff. And we try to do it, accommodating their own language, limitations.
Sure. But the conference focuses primarily on relatives of people with developmental disabilities, correct?
Right.
Take me back to the early years. Did you see that this was the need? I mean, it seems very specific.
Yes.
Rather than broad in general for Latinos in general, this is for relatives of people who have, with relatives of developmental disabilities. It seems kind of narrow, but nonetheless narrow because there's a need.
Right. Well, we started about 13 years ago, we started Premier HealthCare, which is part of the YAI network. And that was started because it was a need for patients in general, not just Latinos, who had intellectual disabilities. They needed a place where they can have all their medical care coordinated because it's very difficult. And they have special needs, obviously. So we have a lot of patients also who are Latinos and who have started to come to our clinics. And we saw that there was a big need for people who, for providers who spoke the language, but also providers who understood the culture.
Yes.
And I think this is how, we started. A group of people started to do the
Well, sit tight. We've teased people enough. We'll tell them where the conference is and when it is when we come back on Tiempo. Much more on the Welcome back to Tiempo. We're talking about the Latino Healthcare Conference, which is coming up. Very important. It helps families with children or others who have developmental disabilities. And it's an important conference. It's going on for 6 or 7 years. Dr. Arlene Garcia is here. We've teased people enough. When and where is the conference if they want to go?
Okay. This year's conference is going to be at the CUNY Graduate Center on 34th Street. It will be held on March 15th. And it's a free conference, but you need to sign up for it. So you can go to our website, yai.org/Latino, or you can call 212-273-6542.
And when you fill out the website, Doctor, that's important because you want to know how many people are coming ahead of time, correct? Okay.
Yeah.
And how many tables, booths are set up to answer the many questions that people might have?
We have plenty. We have at least usually 4 or 5 booths set up with information in Spanish about healthcare, about any entitlements, anything that relates to patients with disabilities. And everything is in Spanish. Everybody who attends and who works at the conference speaks Spanish. So it's a very welcoming environment, and I think people will enjoy.
Right. Maria, your son Randy is 18 now?
Yes.
Has cerebral palsy. The conference has helped you out in the past. Do you find that you've moved into the role of not just advocate for your son, but advocate now for other families?
Oh, definitely. Yeah.
What do you tell them?
Oh, well, the first thing that I say to parents is to accept the diagnosis and work on it and look for the sources and look for an agency. In this case, YAI provides me with all the trainings, support, and still, because my son receives services still, today.
But are you still finding the need to convince parents who speak only Spanish that there is help out there?
Of course, definitely, because they, like I mentioned before, the Latino community are a little different. They prefer, to talk to another parent, open, their heart and say what they really need. So it's better, to share this information, just give the YAI link telephone number where they can answer any questions, any concern, and it's bilingual. So this is the best thing.
And do you find, and Doctor, you can answer this, that the parents are a little bit more open when they're speaking in their native tongue, and they can express themselves in such a way that there's no hesitation about pronunciation or putting it in such a way where the doctor can understand it?
Well, absolutely. And I think, this is one of the barriers that we have is that patients often don't trust the healthcare industry in America. And so they believe better, what the neighbor said, la vecina, take this pill, do that, which is terrible sometimes. But at the same time, because, this type of conference is taught by people who are, they can feel at home with, they often accept information better. not just the language, but the culture and the environment of the
And there are parents also participating in this
Yes.
Conference. So we're always there. So we share, we ask parents, and we introduce to the specialists.
But doctor, how much is that mistrust come from perhaps the healthcare that they knew about in their home country, whether it be Ecuador, Mexico, Dominican Republic, where perhaps it isn't as up to speed as it is here in the United States? That mistrust carries over to here when it doesn't really need to.
Right. I think the mistrust is more about people feeling like, we're doing experiments on them rather than doing our standard of care for the patients.
Okay.
Not so much about feeling that there's, care that's suboptimal. I think it's more of that.
Well, you're doing a wonderful thing. I think you figure, a seventh year, obviously it's growing each and every year. There's a need out there. We got 10 seconds left. Give us the date and the location one more time. March 15th at the Graduate Center.
At the Graduate Center here in Manhattan, 34th Street. Again, the website is YAI.org. /Latino, and the telephone number, somebody will answer in Spanish, 212-273-6542.
Qué bueno.
And
Muchísimas
más
gracias.
importante,
Sí.
it's gratis.
It's free. It's free.
Gratis,
It's free.
yes.
That's a very, very good point.
Yes.
Regards to Randy. Give him a
Thank
big
you so
squeeze from us
much.
from Tiempo.
Thank you.
All right, coming up next on Tiempo.